My name is Nigel Hall, and along with Ian Yardley, we are the lead researchers on the TOAST study, which is being run by the University of Oxford and funded by the NIHR, which is the research arm of the NHS. We are both specialist children's surgeons based in London and Southampton. The research project is investigating how we can best treat babies with a condition called esophageal atresia, so that we can improve their outcomes. Esophageal atresia is a rare condition, affecting around 150 babies every year in the UK, where babies are born without an intact swallowing tube, known as an esophagus. Babies born with esophageal atresia normally require urgent life-saving surgery in the first days of life to rebuild the esophagus. The surgery is usually successful, but children are often then affected by something called a stricture, where there is a narrowing in the esophagus at the site of the surgical repair. In these cases, babies often need to have a procedure called a dilatation, where a doctor uses a balloon to stretch the narrowed area of the esophagus. Each time, the procedure requires an admission to hospital and a general anaesthetic, and some babies need this doing several times. Some surgeons believe that reflux of gastric acid from the stomach increases the likelihood of a stricture, and use a medication that blocks acid production to reduce the chance of a stricture happening. At the moment, about half of all babies in the UK are given this medication, and the other half are not. There is not very strong evidence to show whether the medication works. All medications come with risks and side effects, and we know that parents don't like giving medication to their baby unless they are clear that there will be a benefit.
We started the TOAST trial to find out whether babies born with esophageal atresia should all be treated routinely with antacid medication in order to reduce strictures. TOAST stands for Treating Esophageal Atresia to Prevent Stricture. We've been working closely with the Tofts charity, parent representatives, other doctors and researchers to make sure we answer questions that are important to parents and patients and run the study in a way that is acceptable to both parents and doctors. The TOAST trial aims to recruit 211 newborn babies from surgical units across the UK who have recently had surgery to repair their esophagus. When we do a study like this, we need to put babies into one of two groups. Neither the parents, nor the researchers, nor the doctors looking after the babies will have a say as to which group each baby goes into. This is to avoid bias. There will be an equal chance of a baby going into each group. Half of the babies will be given an acid suppression medication for 1 year, and half will be given a placebo. This is a dummy medication that looks just like the acid suppression medication. Neither parents nor members of the clinical research team will know whether a baby is being given the medication or the placebo. All babies will be monitored closely throughout the study and seen regularly by their doctors. The researchers will record information about the baby's health and progress during the first 2 years of life, as well as about their parents' well-being. Other than taking the medication or placebo and completing some questionnaires, there is no extra burden for parents or babies from being involved in the study. At the end of the study, we will look at all the data we collected to see if there was a difference in the number of dilatations for babies who received the acid suppression medication compared to the placebo. We will also look for differences in the other measures we have recorded. This will help us to know how best to treat babies with esophageal atresia in the future, so that we can improve the care of our young patients. Throughout the study, parents will be well supported by their local team and the research team who will be able to help with any queries. They will also have access to support through the study website, as well as a specially designed and easy-to-use smartphone app. Parents will also record that they have given the trial medication or placebo in this app. If they like, they can also use the app to log other information about their baby's well-being and access information from Tofts, the parent support organisation for babies born with esophageal atresia. Thank you for watching this short video about the TOAST study. For more information, please see the TOAST website, or, if you're interested in taking part, speak with the study team.